It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: stages of canine birth and how long does it take to give birth. There are 3 stages of dog birth. Contractions in the first stage can last up to 12 hours. Cubs are usually born 30 to 60 minutes apart, but the mother may take a break between cubs that can last up to 2 hours. This is what happens at each stage. First stage of canine birth, beginning of contractions. The first stage is the relaxation of the cervix and the beginning of intermittent contractions. However, you are not likely to see contractions during the birth process. Your dog will be restless during this stage, going in and out of the nest, panting, digging, and sometimes even vomiting. He will probably refuse food. This stage can last up to 12 hours. Second stage of canine labor, stronger contractions in birth. The second stage of labor begins with stronger and more frequent uterine contractions that eventually lead to the birth of a puppy. Cubs are usually born every 30 to 60 minutes, with 10 to 15 minutes of intense effort. Expect some puppies to be born tail first, as this is not abnormal in dogs. It is normal for the mother to take a break during the birth process, but it is important to know when to worry and call the veterinarian. Signs of concern are: if your dog has been working hard for more than 30 minutes, if she takes a break of more than 4 hours, if there are fetal membranes in the birth canal without producing a puppy within 30 minutes, if all the puppies have not been born in 24 hours, if the mother appears to be in extreme pain. Third stage of canine birth, placenta. The third stage of labor includes passing all the fetal membranes or placenta. The membranes, also known as the placenta, are greenish-black and should not have a bad odor. The membranes should pass within 15 minutes of each puppy. Therefore, bitches will alternate between stages 2 and 3 with each puppy produced. How many puppies can a dog have? The average litter size varies greatly depending on the breed. Larger dog breeds tend to have larger litters. The average number of puppies in a litter is 6 to 8. But some large breed dogs have been known to give birth to many, many more. Smaller breeds can have 1 to 5 puppies. Dogs that only have 1 or 2 puppies may not go into labor on their own and may require a cesarean section. Singleton pregnancies in dog breeds that do not normally give birth naturally may require a planned cesarean section, which you should discuss with your veterinarian in advance. How to prepare for the birth of a dog. Many dogs give birth naturally. However, there are some breeds, such as English bulldogs, French bulldogs, and other short-nosed dogs, that typically cannot give birth naturally. In these cases, planned cesarean sections are often required. For those who give birth naturally, near the end of your dog's pregnancy, you should create a quiet area to nest during the whelping process. This area should be warm and comfortable, and your dog should be able to come and go as he pleases while he keeps the puppies together. It is also vital that the mother be isolated from other dogs 3 weeks before whelping and 3 weeks after whelping to prevent herpes virus infection. This virus rarely causes illness in adult dogs, but can be fatal to puppies. A pregnant dog's temperature will drop well below 100 within 24 hours of giving birth. Start taking her temperature a few days before her due date. Rectal temperatures are the most accurate. What should be done after the birth of a puppy? Puppies are born with a protective fetal membrane that the mother usually removes shortly after birth. If she does not remove this sac, you will need to remove it manually to stimulate the puppy's breathing. She breaks the sac, clears the fluid from the puppy's nostrils, opens the mouth with the head down, and wipes away the remaining fluids. Next, encourage the puppy to breathe by stroking her body firmly with a towel. If the umbilical cord is not cut during delivery or by the mother, you may need to cut it. But be careful not to pull on the cord, as this can damage the puppy's organs. Tear it off about 1 to 2 inches from the puppy's body, gently tearing it with your first 2 fingers and thumb. If you are unsure or have any concerns, contact your veterinarian immediately. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.